Hi, everyone. Welcome to our 2021 Advocacy Day Issues webinar. I am Barbara Collura with RESOLVE, and joining me is Becca O'Connor. She is with ASRM in their Washington, D.C. office as the Director of Government Affairs. Hi, Becca.
Hi, Barb.
We are going to share with you our issues for 2021 Advocacy Day. We're going to walk through what we're advocating for, what actions we want our members of Congress to take. We're going to share a little bit about why these are the bills that we're going to be talking about. And then just a reminder, we're talking about Advocacy Day that's virtual. Don't come to Washington. It's on Thursday, June 17th, 2021. So just as a high-level reminder, we are going to make appointments for you to meet with your 2 U.S. senators and your member of the House of Representatives. What's really great is we've hired a firm called Advocacy Associates to make all the appointments, and they are going to make sure that you are with everybody from your state. So when you have your 2 Senate meetings, you'll be with other people from your state. And then they're going to make sure that you're with all the other constituents with your representative. What if, however, you are the only advocate from your congressional district? You won't be alone. Advocacy Associates is going to make sure that other advocates from your state, or maybe even from surrounding states, but in your region, are with you. Bottom line is, you won't be alone, and that's your meeting. So your voice really matters. This is a photo, by the way, from a prior year when we could all be in person, and that's what it looks like in those meeting rooms crammed in with a staffer.
Yes.
So we have some broad issues that we're going to be drilling down into some specific bills, but I wanted to share with you the broad issues and sort of how we decided, both ASRM and RESOLVE, to focus on specific bills this year. So we're going to be advocating for bills that are about insurance coverage for IVF medical treatments and also for fertility preservation, for example, if you have cancer or something. So if that's an issue that's important to you, then make a note of that. That's going to be a bill that you want to emphasize and maybe share a personal story about. And I think we can all agree how important it is for all of us to have access to insurance coverage. We're also going to be talking about some bills that deal with access to medical treatment and adoption for our veterans and people who are in the military, those active duty service members. So again, if you're a veteran or you're in the military, or this is something that really speaks to you, make a note of that so that you talk about those bills and those issues. Access to adoption. This is a hugely important issue for the RESOLVE and ASRM communities. And so we have a couple of bills that are dealing with how more people can access adoption to build their family. Health awareness. One of the great things about advocating before Congress is that we use it as an opportunity to educate and inform. And there are actually bills that deal with awareness and research for certain medical conditions. And we're super excited to advocate for some of those this year. Just elevate the awareness about these issues and how they impact our community. Medical research. Wow. I think we can all agree we'd love to see a lot more done in our space, maybe for specific conditions, but maybe just for infertility in general in the area of medical research. So we'll be advocating for that as well. How are we going to keep this all straight, and how are we going to make sure that our members of Congress and their staff know? We have a document that is going to be sent in advance of our meetings to everyone that we're meeting with, and it lists all the bills right on there. It's got the bill number, it's got even the staff contacts. So if somebody says, wow, I really care about veterans and military access, I want to support those bills, the information on how to do that is going to be right on this document. What's also great about this document is that it has an infographic with lots of facts and figures about infertility. So it serves as this great resource for the staff person. If by chance the staff person hasn't seen that before your meeting, that's actually sometimes even better. You'll send it to them as a follow-up. But either way, the staffer will have, and the office will have that document. We call that our leave behind. When we were in person, we used to physically hand it to the staffer at the end of the meeting and leave it with them. So what's great is that you can talk about your personal story. You can talk about why these issues are important to you. And all of those little details are going to be on that document for the staffer. So drum roll, please. We have a total of 9 bills. I don't think we've ever had that many bills to share and to advocate for. So we're gonna highlight a few of them in the meeting, because you only have like 10 or 15 minutes in that call with your members of Congress. So we're going to walk you through kind of how to highlight these bills, but we're hopefully today going to give you a little bit of insight. So with that, I'm going to turn it over to Becca. And if you want to start with the ones that we're going to ask people to focus on in their meeting, that would be great.
Absolutely. And as Barb said, time is limited. I'm going to give you a brief pitch. We're going to reiterate it on the leave behind. So don't worry, you don't have to write all of this down as you listen. You'll have this in front of you. But so let's start with the Access to Infertility and Treatment and Care Act. Here's how I might pitch it when I'm sitting down. I've got my 15 minutes at max. We're asking for their boss's support for the legislation, which will make sure that those who receive health care through government-sponsored health plans like TRICARE and through the VA have coverage for infertility services. The bill also will ensure that they have access to, as Barb mentioned, critical fertility preservation services. And those are, of course, important to people like cancer patients who are at risk for infertility due to medical treatments or surgery. So it's just that simple, a quick little snippet to give them a tease of what it's about and why it matters to you, share your personal stories. And again, that's a footnote, we will have these resources ready for you to glance back at. But that's a hugely important bill for all of us to be sure we're flagging.
That one also covers the private market. So it also says in the bill that people who aren't covered under medical plans offered by the government, so that would be all the private employers, and it's
right.
saying this coverage is needed and is important.
Yep. Okay. And then Barb also touched on this, medical research funding. Boy, do we need it. There's so much we still don't know and need to understand. So what we do is we focus our efforts on funding at one particular institute at the National Institutes of Health called the National Institute of Child Health and Human Development, or NICHD, which is really the institute where most research into reproductive health and infertility is supported. And this year we're asking for a funding level of $1.6 billion for fiscal year 2021 for the NICHD. 2022, sorry, years pass quickly. And I want to make sure that you don't get caught up in the weeds. This is part of the appropriations process. So when you're talking to lawmakers, just flag that you're supportive of funding for the NIH and for the NICHD, and will they please support it as well?
Awesome. Thank you, Becca. And you've mentioned this a couple of times. The purpose of really this webinar is to kind of give you the big picture. You're going to have opportunities with your state delegation. We have fantastic handouts that are going to go through these bills in a lot of detail. And then remember, the staffer will have that leave behind with all the specifics. We didn't even list the bill numbers on here because we didn't want to get it all confusing for you when you really just need to focus on your story and the message. So the Veterans Families Health Services Act. Okay, this is one of those bills. You've already heard of the first one that covers some veterans and military. Here's another one. This is a bill that we've actually been advocating for, for at least 8 or 9 years. And it was originally focused on wounded veterans, and it was allowing wounded veterans access to IVF through the Veterans Health System. And all of us have been super duper supportive of this issue, and we've had some success on it. This is the bill that will make the VA access permanent. This particular bill this year, though, goes a little bit further. It also does some nice things in covering our active duty service members, and the service connection part of it is not as important. So this is a pretty expansive bill. What I would focus on is that our veterans deserve the best health care, and right now they are not getting it. And so this is a bill that will solve that problem for our veterans and make IVF through the VA system permanent. And we want that. And then we have the Adoption Tax Credit Refundability Act. This is another issue that we've been advocating for many years. This is hugely important for people who are trying to build their family through adoption. And it really is focused, a refundable credit is focused on people who are at the middle to lower income level. And so it's hugely beneficial to so many families. And it really is one of those credits that is only used for the right folks, right? There's really no way that you can kind of fudge this. And so it's putting money and a credit in the hands of people who really need it and want to build their family through adoption. This is supported by the entire adoption community, and quite honestly, it's very bipartisan in the House and the Senate. So you should receive a lot of support for that. So we're going to ask you in your meetings to focus on these 4 out of the 9. And the ask is, can you please co-sponsor and support these bills? They are important to us and our community and important to me. So what are the other bills that are going to be on that leave behind that we want you to focus on in your follow-up? Let's see what those are. See if I can get my screen to change here. This is always what happens, right?
Mm-hmm.
Okay. I'm going to share the first couple, and then Becca, you can finish out the list.
Sure.
So on that leave behind, and part of our ask for our members through that leave behind and through our constituent letters and through our follow-up is we're going to focus on these 5. The other 4 are what you're going to focus on in those few minutes that you have with your staffer. So there is a resolution that was just recently introduced in the House. It's an infertility awareness resolution. It is a fantastic resolution in that it really outlines the challenges of people have with infertility. It talks about the disparities. It talks about the lack of insurance coverage. It talks about the emotional toll. It's got facts and figures. It's a really good resolution that we want to have get passed. So we need members to co-sponsor it so that it comes up for a vote. It's a really nice way of summarizing and showcasing what needs to be done in the area of infertility and family building. There is another adoption bill, Every Child Deserves a Family Act. We are part of a wide coalition also supporting this. This has a huge number of co-sponsors in the House and the Senate last Congress, and a lot of organizations are advocating for this. Right now, there are some states that have passed laws that allow adoption agencies that actually receive federal funding to discriminate against who can be an adoptive parent. And they're typically discriminating based on religion. For example, discriminating against a Jewish family because maybe the adoption agency is faith-based, is Catholic or Protestant. They're discriminating against adoptive parents because they're single. Maybe it's a single woman. And they're also discriminating against adoptive parents who are same-sex couples. And also this bill helps kids who are in foster care who identify as LGBTQ. It does a lot of really good things that we are very supportive of. So Every Child Deserves a Family Act will be one of those that you will use in your follow-up, and it'll be in our leave behind. And I'm going to turn it over to Becca to tell us about the last 3.
Sure. So the next one is a PCOS awareness resolution. So again, PCOS is one of the issues that is important to both RESOLVE and ASRM. It's a lifelong health condition that's impacting 5 to 10 million women and girls in the US. It's a leading cause of infertility. So something we definitely want to keep front of mind for lawmakers, and something that has a lot of bipartisan support. Like the earlier resolution, it lists out some of the causes and concerns of PCOS, and we just want to make sure that we're working with them to designate September as PCOS Awareness Month and bring this much needed attention as we continue to work through it. The next bill is the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act. Ooh, say that 3 times fast. Thankfully, you don't have to. But this is something where, as you may know, about 26 million Americans have uterine fibroids, which are tumors, non-malignant, that grow in the uterus, and it's terribly painful, and something that we know disproportionately impacts the African American community. And this legislation is designed to improve funding for research and increase education around this disease. Specifically, it establishes new research funding through the National Institutes of Health to address it. Just a great thing to raise awareness on. It's a new bill and one that we really would like to see broad bipartisan support around. And finally, the Veterans Infertility Treatment Act. This legislation was reintroduced this year by Congresswoman Brownlee of California. It makes it clear that infertility, we talked about discriminatory behaviors and how it impacts your access to service. Well, this makes it clear that infertility is a healthcare need like any other that the VA must cover. And that it has to be covered, including in vitro fertilization, for enrolled veterans struggling with infertility, regardless of their marital status or their service connection or their need for donated gamete material or the like. Again, sort of a no-brainer to all of us, but it's really important that they hear from you that this matters and why, particularly those of you who have a service connection and can speak to your personal interests in the matter.
And I just want to mention that some of these bills are introduced in just the House of Representatives. Some of them are introduced in both the House and the Senate. Again, all of that information will be on kind of your script when you're in your meetings, so that you're making sure to focus on the right things. And then these 5 right here, you won't actually be talking about in your meeting, but you will be mentioning in your follow-up, and of course they are on that leave behind. What's really neat about this is that if one of these 5 issues really resonate with you, then we encourage you to have personal follow-up with the staffers that you meet with and say, hey, the PCOS Awareness Month is one of the bills that we care about, and I want to tell you why that one is especially important to me. Perfectly fine to do that in your follow-up and your outreach, because remember, we're building a relationship, and Advocacy Day is not just June 17th. Our goal and our hope is that you maintain a relationship with these staffers well past June, and these are going to be fantastic opportunities to keep all of our issues front and center with them. So let's see if we've got anything else to share. That's it. Wow. So those are the issues. We are super excited that you're going to be participating in Virtual Advocacy Day. Just a quick reminder, you are going to be contacted by your state captain. They're going to make sure that everyone in your state is organized and ready to go for your meetings. And look, as Becca has said, your story is what is most important, and you don't get worried about all of these details. This is just giving you an overview, and you're going to have materials in front of you, and you'll be able to beautifully share our asks and your story. However, if you have questions, reach out. Advocacy@resolve.org gets you right into someone's inbox that can respond to your questions. So we are thrilled to have you. And Becca, thank you so much for joining me today.
Thank you. I can't wait to see you June 17th and all of you.
Bye-bye.
Bye.